Should you remove all moles if you suspect the symptoms? Oh, that's a difficult one. I'm going to say no. I'm going to come down one way or the other. I'm going to say no. I think if you suspect symptoms, or if you have symptoms, you should get them checked out. I think that's what I would say. You for sure need to get them checked out. But the problem is if you start removing every mole that gives you some symptoms that maybe changes slightly or starts to cause some problems, then you might end up trying to remove all of your moles, which is a not great situation to be in, and can be never ending because you might get new moles. So I wouldn't recommend kind of removing all moles at the drop of the hat. I would recommend having a low threshold to remove a mole if there are concerns about it. But what we normally tell patients is the things to look out for to seek help if you have those things: bleeding, itching, change in size, change either way, bigger or smaller, change in color, darker or lighter, indistinct edges, halo areas around the side, satellite lesions. There's certain things that we would tell people to look out for. But if you get one of those things, it doesn't necessarily means it's malignant, and it doesn't necessarily mean it needs to be removed. So you don't necessarily have to have every symptomatic mole removed, particularly if it's a cosmetically sensitive area and you kind of like the mole. If you don't like the mole, and if it's not in a very cosmetically sensitive area, and it's just kind of one or two we're talking about, it's probably better to err on the side of caution and to remove it. But if you don't like the mole and it's in a place where it's not really, you're not going to be too concerned about scar, you're best to err on the side of caution and have it removed. But I don't think you necessarily need to remove them all if there are